How about that welcome? Thank you very much. Let me start by ensuring that everyone in this room, let's give the warmest West Virginia welcome to HHS Secretary Robert F. Kennedy, Jr. Guys, why don't you take a seat? I want to thank everyone so much for being here. I want to thank all of the elected officials. I want to thank our wonderful First Lady of the state of West Virginia, Denise. I want to thank the leaders of the MAHA movement in West Virginia. We want to thank the principal of the school, Maria Bird. Our secretaries of Health and Human Services, Dr. Arvind Singh and Alex Mayer. And we also have a special shout out for the key leaders in West Virginia who have made today's event possible. I'm going to go through them real quick, and they're going to have a moment to speak in a few minutes. Chairman Jason Barrett, who also represents you right here in this district. We have Chairman Evan Worrell. Oh, there you go. I'm sorry. By the way, I want to note that Summer Barrett, who's married to Jason, she's a MAHA mom. We have Chairwoman Laura Chapman, good friend. Thank you for coming up. And Chairman Adam Burkhammer. Adam's been a big leader here. Thank you. But most of all, we're really grateful for our special guest, RFK Jr. And quite frankly, not just for being here, but being one of the few voices in the country willing to speak the truth, even when it's inconvenient. Now, we're here today to talk about some very serious issues impacting West Virginia and our country. And there's no way around it. West Virginia ranks at the bottom of many public health metrics. We lead most of the country in obesity stats, heart disease, diabetes. Our children are diagnosed with ADHD at rates well above the national average. And we have one of the lowest life expectancy rates in the United States. That's the bad news. But we have good news. We have the power to change it. Yes, we do. And I plan to lead by example. I plan to travel this journey with you, and I'm going to do my best, my personal best, to make the hard choices to get healthier. You see, I want all West Virginians to have happy, long, healthy, and purposeful lives, spending time with friends and family and all the things that really matter. And I'm not afraid to admit that I've not always made the best food and exercise decisions in my life, but I will do my best to get better. That's why today I'm proud to launch what I'm calling the 4 pillars of a healthy West Virginia. First, we have to clean up the food. We really do. Let's start with no more dyes and dangerous additives in the schools. We know that studies show that can lead to issues with hormones and hyperactivity and learning challenges for our kids and even cancer. Our kids deserve better, and now they're going to get it. You deserve that. That's why, earlier this week, we took the first step to remove those harmful dyes from school nutritional programs and food items throughout the state. I'm thankful to the legislature for their leadership in passing this bill and making West Virginia a leader, the first state in the nation to make sweeping changes to clean up our food. I'm hopeful that this new law is going to lead to a broader national discussion and FDA action so we can have more consistent policies across the nation. I'll start with our second pillar, find purpose, find health. Throughout all of our 55 counties, I want all West Virginians to find a purpose that helps them spring out of bed in the morning and helps them lead healthy and purposeful lives. As the state with the lowest workforce participation rate in the country, one of my priorities has been getting West Virginians back to work. Yep. So, today, I'm announcing my intent to expand work, training, and educational requirements for SNAP recipients. You know, I think we can all agree, work is good, work is moral, and it helps us to be stronger in the mind and the body, and we need more of that right here in West Virginia. Outside of limited exceptions, if you have the ability to work, you should. Pillar 3, move your body, change your life. I think all of us know the benefits of exercise, not only for our physical health, but for our mental and spiritual well-being as well. Now look, I stand before you today. I'm not pretending to be a fitness guru, certainly not the way it may have been 30, 40 years ago. But I have asked Secretary Kennedy to be my personal trainer. And he hasn't said yes yet, but I think he's sizing me up as a major renovation project. You know, unfortunately, most of us don't get the exercise we need, myself included. But in order for us to get healthy and start to move the needle in terms of where we rank in many of the public health metrics, we all, as a state, must start exercising more now. That's why today, part of our third pillar, I'm announcing a statewide exercise movement. We're going to call it the Mountaineer Mile. I'm challenging every West Virginian to get out and walk at least 1 mile per day. As governor, I understand that I need to do this as well and start shedding the pounds. So in the future, you might start seeing me walking around the Capitol complex a little bit longer. You might see me in many of our amazing state parks. Plug for our state parks, best in the country, right? And you also might see me doing more walking closer to home in the Eastern Panhandle. Our fourth pillar, we want to reward healthy food choices. We need to change the SNAP system so that West Virginians are incentivized to make healthy choices, like choosing fresh produce, lean meats, and natural foods over a lot of the ultra-processed crap that barely qualifies as food, right? So, beginning today, we're asking for help to realign SNAP so that good food choices are easier to make. If taxpayers are paying for it, let's make sure it fuels health, not disease. But, and I'm being serious about this is not about judging someone's grocery cart. It really isn't. I don't want to do that. I don't think anyone here does. But it is about asking a fair question. Is the SNAP program doing what it was supposed to do? You see, SNAP stands for Supplemental Nutrition Assistance Program. That N is for nutrition. It's not for nonsense. If the law says the program is meant to help people get a more nutritious diet, then that should be the standard. Why should hard-earned federal and state tax dollars be allowed to ignore nutrition? Taxpayer dollars should be targeted toward nutritious foods. That is why today I'm also intending to request a SNAP waiver from the federal government to no longer have taxpayer-subsidized soda as an entitlement under SNAP. We're also going to be incentivizing healthy bundles and other food choices that can help people access and eat better foods, healthier foods. That healthy bundle and other programs, that's going to expand access to healthy food choices in this area and all 55 counties in the state. Quite frankly, I think we can do it, and we can also even save money, federal money, at the same time. I'm eager to work with you and the entire Trump administration on that. Making America healthy again, and West Virginia healthy again, that's not just a slogan. That's going to be our mission. And here in the Mountain State, we are leading the charge. And that's because in West Virginia, we're not just climbing the mountains, we're moving them. Let the rest of the country take note. We're cleaning up our food, we're lifting up our families, where tax dollars are involved, we're incentivizing consumption of healthier foods, we're respecting the dignity of work, and we're living up to our name. Wild and wonderful, and now, a healthier West Virginia. So, it's my honor to be here today. I thank you all for coming. God bless you. Now, I'm going to take a moment and get ready to turn this over to his fine gentleman next to me.